My name is Adawal Lanihuna, and in this study, I'll take you through a presentation about the impact of nursing research in evidence-based practice. Background of our study. So in this study, we will explore a PICOT nursing research question. So nursing research is one of the fundamental tools that is used in formulating inventions and reinventions of practices. It has been shown that a course that develops a researchable question in exploring the mission is key to arriving to a concise outcomes of the patients. So the results found in the research provide a very useful way of helping patients because it is highly reliable inference of the disease that the patient is suffering from. However, because the patients have to be insured, we have to look at reliability, validity, and the usefulness of the research result. So researchers are thereby allowed to look for a valid way that will help them to reach their objective. This will depend on the objective of the sample they are selecting and the proper application of descriptive statistics. So accurate descriptive statistics guide the attainment of proper inferential statistics. Aim of our study. This study will explore PICOT question inclined on researching the issue of antibiotic prescription to UTI patients, majorly aging women. So mostly we use antibiotics in treating UTIs, but improper prescription has always negatively affected their action. On many occasions, overprescription and late prescription are very common. It has been found that most of the patients, they may be overprescribed of the drugs or they may face delayed prescription. So, for instance, the result of poor diagnosis that challenges nursing to conclude the existence or non-existence of enterococci. The enterococci is one of the most causative agents of the UTI. So in many cases, UTI is often confused with other bacterial infection, which is known as the asymptomatic bacteriuria, which is bacteria in the urine. So you find out that many doctors or many nurses will think that the patient has UTIs, but the patient is infected with the asymptomatic bacteriuria. Hence, mistakenly prescribing of antimicrobial when the patient is actually suffering from UTI results to severity of the disease, and also the vice versa is also true. So the concise knowledge about UTI symptom is vital in diagnosis to prevent wrong prescription. According to Alley et al. 2018, so he found that UTI symptoms include dysuria, urgent and frequent urination, flank pain, along with other Madaras and cloudy urine. Literature review. In this literature review, we just looked about some cases of these UTI infections, and it was found that most of the women who suffer from UTIs, they develop the problem of bloodstream infections if that is not checked. So, delayed antibiotic prescription for UTI for the patients who are aged more than 65 years, this makes them to be susceptible to these infections, which further expose them to high probability of mortality. Although antibiotics effectively eradicate the enterococci responsible for UTIs, more than 50% of the prescriptions are noted by Gabi and colleagues as unnecessary. So you find that most of the doctors or nurses, they prescribe these antibiotics unnecessary because not most of the patients suffer from UTIs. On the other hand, Abu Haida et al. Found that further improper treatment of UTIs has been the core reason why this prevalence and recurrence risks are increasing. The authors show that the ratio of UTI occurrence in females and males in US is 2:1, and its prevalence increases proportionally with age, meaning that as you age, as these women age, there is high probability of them getting these infections. Antibiotic stewardship effectiveness for UTIs broadly depends on further diagnosis followed by proper antibiotic prescription for treatment. Further on literature review, we also found that apart from age, there are also other risk factors that are associated with UTIs. For example, a study carried out by Rodriguez-Manas in 2020 urged that immunosenescence, exposure to nosocomial pathogens, multiple comorbidities, and history of UTIs is very significant when we come to the risk factors. Also, another study found that out of that, the incidence of clinically diagnosed UTIs increase with age, meaning that as these women advance in age, their risk to get infected with UTIs also increases. So, it has been found also that UTI prevalence and recurrence pose a serious social and economic burden to a country. Because the aging population is susceptible to many illnesses, and these illnesses are very interdependent. So economically, treating UTIs is costly and is a burden to a country. For example, in the United States of America, half of the total women population suffer from at least one type of UTI. Another recent study by Shafrin and their colleagues in 2022 found out that UTI overall treatment cost stands at approximately 1.6 billion in the United States. Similarly, in the US, UTIs have been noted as the most outpatient infection, that is according to Medina and Castillo-Pino research they carried out in 2019. The statistics are eliciting questions on why they are showing staggering UTIs continues despite the fact that we are using the antibiotics, which we find that they are very useful and very effective in treating the UTIs. So we find that we are using antibiotics, yes, but the risk and the population which has the UTIs is increasing. So what can be the problem now? So the results of our study. Generally speaking, it can be asserted that inappropriate diagnosis and treatment methods for UTIs are responsible for the challenging control. Focusing on accurate diagnosis is vital in informing antibiotic prescription. Nurses are expected to rely on accurate diagnosis results to make treatment decisions. Suspected patients should be closely watched via regular screening to ensure precise results concerning the infection existence are attained. For instance, when positive results have arrived at, it is clinically advised to initiate antibiotic prescriptions immediately as this has far-reaching positive results. Immediate antibiotic prescription will mean early management of the infection, which consequently promises quick and unchallenging enterococcal eradication. Standard diagnostic method for UTIs are urinalysis, ultrasound, cystoscopy, and CT scan. Urinalysis is the most one used to check the presence of the bacteria in the urine. However, the rest of the methods are preferred when no results are found using urinalysis for the suspected patients. Hence, the essential aspect of managing UTIs is proper diagnosis and mediation and immediate antibiotic prescription. So when a patient has taken a sample to the lab and the diagnosis has been carried out and found that the patient is really suffering from the UTIs, it's therefore useful for the patient to be given immediate antibiotic prescription, so that will improve the results of the patient. Conclusions. So, to conclude, we found that managing UTIs through effective treatment is vital as it helps to restore health in the patients. Nursing core role is to strive and restore good health in suffering patients. As a way of promoting public health, treating burdening disease like UTIs is a part of the nursing major accomplishment. So, based on the challenges surrounding UTIs treatment, that have been discussed throughout this study, nurses are now aware of the areas of weakness that have remained challenging in the successful treatment of UTIs. By systematically adhering to the standard diagnosis and treatment methods, nurses will more likely experience successful UTI management. Nursing research is therefore a critical aspect of nursing practice that opens roadmaps to treating a myriad of infections. They rely on evidence from empirical studies that follow the systematic path in describing the health issue and making solution inferences. So references. So my work was obtained from these few research articles that have been carried by so many researchers, and they updated. So the work is from these studies. Also, there are also other references of my work. You can find out them there. Thank you very much.